Hi, my name is Alyssa Douglas, and today I'm going to be demonstrating some swallow maneuvers. The first maneuver we're going to review is the Mendelson maneuver. This maneuver can be used for patients with reduced laryngeal elevation, reduced UES opening, and pharyngeal residue. So what this does is it elevates our larynx to the highest point. By elevating the larynx, it allows the airway to be protected for longer, and it allows the UES to be open for longer, therefore directing the food into the UES more efficiently. So to do this maneuver, you want to have the patient determine their highest point of elevation for their larynx. So you would have the patient swallow and feel their throat. And then we want to note where that highest point of elevation is. So for me, it was right under here. And we're going to have the patient swallow, and you want them to hold that swallow at the highest point. So mine was up here, so I'm going to swallow, hold it at the highest point for a few seconds, and then resume the swallow and relax. So it's going to look a little something like this. So what you can do also is have the patient start out with a dry swallow, so just using their saliva. This will help the patient get used to the exercise and be able to perform it well before introducing food or liquid. Later on, once the patient is understanding the maneuver and performing it correctly, you can add food or liquid to also do this maneuver with. The next maneuver we're going to discuss is the Masako maneuver. An important note about the Masako maneuver is that it is not used with food or liquid. It is strictly only performed with the dry swallow. It can be used for patients with reduced tongue-based retraction and also reduced pharyngeal wall movement. So what this does is it forces our pharyngeal wall to move anteriorly to connect with our tongue base, and it forces a connection between the two. So how it is performed is the client will hold their tongue gently between their teeth, and we will have them perform a swallow. Initially, you may want to hold the client's tongue on your own for them to get a better understanding of how the maneuver is performed. It's going to look a little something like this. Another maneuver used frequently in dysphagia therapy is the effortful swallow. This maneuver can be paired with other maneuvers to help improve swallow function, or it can be used as a compensatory strategy. This can help improve tongue-based retraction, pharyngeal residue clearance, and it can help generate pharyngeal pressure to help propel the bolus towards the UES opening. What it does is the hard swallow increases the amount of posterior tongue movement and pharyngeal constriction. It also helps build pharyngeal pressure, which helps push the bolus down toward the esophagus. You want to instruct the patient to take a sip, close their lips tightly, press their tongue against their hard palate, and swallow hard. A helpful cue may be something such as swallow as if you're swallowing a golf ball. This may help the patient understand just how hard we want them to swallow. It's going to look something like this. The next maneuver is the supraglottic swallow. This can be used in patients experiencing aspiration or penetration before or during the swallow. So, you want to instruct the patient to take a breath, hold their breath, swallow as they are holding their breath, and cough immediately following the swallow. What this does is allow us to close the vocal folds before our swallow and while the bolus is passing through the pharynx. This helps reduce the likelihood that any of the bolus will enter the airway. The cough at the end also helps to expel any food or liquid that has entered the airway. It will look something like this. The next maneuver is similar to the one previously discussed. This is the supraglottic swallow. It can be used in patients with severe airway protection impairments. The patient may display signs of severe aspiration or penetration before or during the swallow. You want to instruct the patient to take in a breath, hold their breath tightly, press their hands firmly together, and swallow hard. The patient should cough immediately following the swallow. This allows for tighter airway closure as the bolus passes through the pharynx. The cough at the end ensures that any food or liquid that has entered the airway can be expelled. It can be performed like this. The last maneuver we are going to discuss is the Shakir maneuver. This maneuver can help strengthen the suprahyoid muscles, which in turn improves UES opening. It can also help reduce the amount of pharyngeal residue. To perform this maneuver, instruct the client to lie flat on their back. The client will lift their head to look at their toes. When the client lifts their head, ensure that their shoulders are flat on the ground. Ask the client to hold this position for 1 minute. After 1 minute, the client may relax for 1 minute and the exercise can continue on. An important note for this maneuver is that it is not performed with food or liquid. The maneuver may look something like this.